One of Arcadia's most important strategic priorities is improving our customer satisfaction as well as their trust in the data that we provide to them. A lack of trust in data is really common in this industry because the data is so complicated and there's so much of it. It's really important for us that we build an infrastructure that can support that data for the clients to be able to use for their analytics. So as we increase trust in the data, we can improve client satisfaction, then we start to unlock a lot of possibilities to do these advanced projects and make a real impact in healthcare. We've spent the last few decades talking about interoperability, and I think these disparate and different formats across healthcare data have created a lot of struggle with this particular issue. But today, with the advent of AI, a lot of that complexity starts to diminish because we can use AI to help us actually map things more efficiently. I think the bigger issue that we're facing today is more about the meaning of the data. So in healthcare, we have these very similar concepts across different systems that get interpreted just slightly differently. And with that difference in meaning, just with even the most basic of concepts, it's a real challenge to try to integrate data across systems. Citius is becoming an integral part of our staffing strategy specifically for all of these different functions. And it's really important for Arcadia to have the ability to expand and contract staff quickly as we meet different demands of the marketplace. And Citius is a great partner to help us to do that. So Citius is really helping us to be able to accomplish that mission of getting all of these complex and disparate projects done in an efficient way. In the United States, most cutting-edge technologies end up with consumer products. Like that's where the money's at, and so that's where a lot of companies focus their attention. With healthcare though, with the complexity, the cost, there's this huge opportunity to use technology and data to make the whole system more efficient and function better. So when we use partners like CitiusTech, it changes the cost structure to make it more possible for healthcare to be able to afford some of these more advanced technologies to move the mission of healthcare forward for everyone. What we really value is CitiusTech helping us facilitate a cost structure that helps us achieve our mission. We need that cost structure to help us to continue to move forward with the healthcare market in the United States. A good example of this is, recently we've had some challenges with getting all of the volume of work done. And we asked CitiusTech to help us do that. And with that partnership, we were able to burn down some of that queue of work. And then quickly, we had another problem, a different volume of work problem. And we were able to pivot quickly, not only through expanding staff, but also through moving some people who are now trained to focus on a different problem. And that really helped us operationally to succeed and help service our clients in ways that we wouldn't have otherwise been able to do. AI is a game changer here. There's incredible opportunities to use AI to improve the way that we work. But in my experience, especially with healthcare in the US, there's a lot of entrenched thinking and process, and the real path to success is through incremental change.